We wanted to give you, from our subjects that we have used and trialed the product on, we have received significant amount of feedback. The most important feedback is it's comfortable, easy to use, but secondly is it's sort of the aha effect. I didn't know that. And that is the power of seeing the data in this group of patients. And what's significant here is it's basically diagnosed very early. You're able to see it and take corrective action years before. And of course, clinicians, the GP in this case, saying that you're too young, performs an oral glucose test, confirms it, and then is also surprised. But without the power of this data, it couldn't have been accomplished. And if we think about what are we trying to do here? Well, with type 2 patients, every 1% reduction in HbA1c levels leads to a 15% reduction in late-stage complications. That's significant. And the late-stage complications we all know are either retinopathy, neuropathy, also kidney disease, etc. The same as with type 1 or intensively managed high-risk patients. So therefore, catching this early allows someone to change their lifestyle. It allows also the clinician to consult and also support the patient in lifestyle changing process. I want to give you some color from two other patients that we have. The first one is a 54-year-old male, non-diabetic, with a BMI of 23. So someone, doesn't really appear that, they fit into this negative family history for diabetes. And a local volunteer who was using or helping us with the device, again, out of curiosity, started using sugar beet, just wanted to see for a few days what's his profile look like, and was alarmed by some very high results. So I had some full tests done last week and was confirmed to be a type 2. So therefore, the general practitioner stated here that the condition could have been symptom-free for another 2 or more years, progressing along, if the person had not used sugar beet. Another patient is a female, 41 years old, positive history for diabetes, T2 basal insulin since 2013, so 6 years, with a BMI of 30. She had quite a bit of fluctuation in the range for many months, from 5 to 24 millimoles, and had been recently prescribed dulaglutide, which has brought down that range to 4 to 12. But what was done here was sugar beet was then used as a retrospective therapy adjustment. Yes, she was on the long-acting insulin, but then therapy optimization was performed, i.e. what is the right dosing level, what is the right timing of this. Yes, it is a long-acting insulin, but is she getting the right level? Also, was she in need of maybe having a second oral agent here with this long-acting insulin? So that decision can be taken by looking at these profiles here. And again, the goal is to bring more time in range, time in the zone, bring that up to 70%, also for type 2 patients, as we've also recommended for type 1. And if we look at the curves that Ian Cranston showed us earlier with the Libra product in those 2 patients, if you took a look and just did back of the envelope math on that, as I did as I was sitting there, I was looking at the type 2 patient, and they only had 10 of the 24 hours where they were in range. Otherwise, they were outside of the range, well above it in a metabolic stress situation. So they were only in range about 40% of the time. But as Ian has stated, you don't need 14 days worth of data to see that with a type 2. 3 days are sufficient, or maybe a few more, but nevertheless, there is less variability there.